Hi, my name is Margit Anderson, and this is my slideshow for our theoretical framework and our application to personal advanced practice as a primary care nurse practitioner. So first, we're going to go over the objectives. So basically what I'm going to talk to you guys about in this presentation. First, I'm going to describe the theoretical basis and the role for the primary care nurse practitioner. I'll go over the theories that I selected and the reasons why, and then I'll talk about how I'm going to apply that to practice and then go over my conceptual model. So first we'll dive into the role of a nurse practitioner. The nurse practitioner is able to assess, interpret, diagnose, order, prescribe, and treat patients. The difference between the nurse practitioner and the physician is that they have more of a holistic caring approach. So they're kind of focused on caring for the patient, which is one of the theories that I will dive into later on. And then we'll talk about why nurse practitioners do what they do and what they base it on. And it's going to be based off of different philosophies, theories, ethics, and we'll go into that the more we go into the presentation. So the first one is the family theory. And the one that I decided to do is called the family systems theory. And it's basically how individuals are influenced from their environment and family dynamics. And so there's 4 different concepts within the family systems theory. The first one is that everyone is connected. And so if one person is affected, everybody else in the family is affected as well. The next one is it's more than just the individual, kind of the same thing as the first one. Whenever you're dealing with one person, you're kind of dealing with everybody else in the family as well. All families have boundaries is the third, and then the fourth is families are organized into subcategories. So you don't just have the immediate family, you've got grandparents, cousins, aunts, uncles. And then next we'll talk about how I apply it to the role as a nurse practitioner. So nurse practitioners can answer questions to assess the patient's environment and know the potential outcome of the prescribed treatment. So basically, if the nurse practitioner knows what the patient's going to go home to and how they are on a day-to-day basis, they can kind of help. This can kind of like tell them, will they succeed in their treatment? Do they have the appropriate resources or the care from home to help them succeed and have a more positive outcome? So questions that are going to be asked are, who does the patient live with? Do they live by themselves? Is their significant other still living? Are the kids involved? Are the parents involved? Do they have their biological parents? You're going to want to ask how many people live in the household. Exposures to drug and alcohol. So not just if they smoke or drink or do any other street drugs, but also are they exposed to it at home? Do they feel safe at home? And then also if the family members at home are able to meet the needs of the patient. So if it's an older couple, is the patient's husband or wife, just kind of in the same condition as them? Are they just as sick, if not more sick? And then a lot of the times these questions are incorporated into the triage process of the chart, which is nice. So basically the provider won't miss asking these questions. And sometimes the RN actually is able to ask those questions and provide the NP with those answers. Next, we'll talk about the nursing theory. The one that I decided to do was a theory of human caring science by Jean Watson. It was definitely one of my favorites. So Jean Watson focuses on human dignity, wholeness, caring, and healing. She also focuses on self-love. She thinks that we basically have to love ourselves before we can love others, especially showing love to others. And then she describes caring just as important as curing. It gives the patient a reason to fight, and then it benefits both the patient and the nurse practitioner whenever we take care of patients from this approach. And I think that this is something that can kind of come with practice too. The more that we are exposed to and the more that we see, sometimes it can either make us more of a caring provider, and sometimes it can harden us as well. So we have to be careful with that and kind of come back to this theory when we start to get that hardened approach. to where we're kind of just numb to things. So this is something that you can focus on as a provider to kind of bring you back to the surface. So how we can apply that to our nursing practice, we can show sensitivity towards patient. Every patient is different. All of the circumstances are individual, and everybody experiences these things different. All of us have a different threshold for pain, and kind of what we can handle, how we grew up. There's so many different factors that go into it. We can also have a trusting relationship with our patients, letting them know that they're not just a number, that we're there, we're caring for them, we want the best outcome. We also want to accept the patient's feelings, even if it's something that we don't agree on, even if we think that they're being over dramatic or under dramatic or taking this too serious or not serious at all. We're going to accept the feelings as they are. And then we also want to make sure we meet the needs of the patient. And I don't just mean prescribing the right medication or the right treatment, but also meeting it in more of a caring approach. So, sitting close to them if it's, not COVID season, sitting close to them, maybe putting a hand on their shoulder, prescribing pain medication. If you're in the bedside setting, getting a warm blanket. Something that Jean Watson really focused on was just being intentional and in the moment. And so when that patient feels like you truly care and are being intentional with them, it might give them more of a will to, play a part in their health care, and also see that if you as the provider have hope, it gives them more hope too. The next one is the leadership theory. And this one was discovered by Henry Mintzberg, and it's Henry Mintzberg's theory of management. Basically, he talked about why managers do what they do, and then the skills to be a successful manager. And then he broke the manager role down into 3 different roles, and that is interpersonal, informational, and decision-making. He felt that a manager should actually be able to play all 3 different roles. And then the skills that he thinks that a manager should be able to do is work in a fast-paced environment, have kind of a variety because you have a lot of different employees, and then also knowing up to date, like current issues, and then in this case, current medicine, different treatments, what's being talked about on the news, being able to speak well to the media, and then also kind of being able to control your emotions. As a manager, you don't necessarily want your emotions to get in the way of making the right decisions. So basically how we can apply this management theory to nurse practitioners is nurse practitioners actually, especially in the primary care setting, manage the patient's entire treatment plan. So if you are the primary care provider, you could be referring your patient to a cardiologist, to pulmonologist, nephrology, all these different things, but you are the primary care provider. And so you're managing this person's treatments and outcomes. So you can take this, even though it's a management theory, more like a business management theory, you can actually take this as a nurse practitioner, because you're going to be handling so many different things. You're going to be working at a fast pace. You're going to want to be up to date on their medical needs. You're going to want to speak well to the people that you're referring them to, the nurses, the providers, physicians, all that. And again, you're going to want to control your emotions in these instances, because these specialists, they could think differently than you, and obviously they're focused on something that they may know more than you know. So you just don't want to let your emotions get in the way of that. And then also it helps to make the decision and looks at the treatment plan as a whole. And then there are a lot of nurse practitioners in business management, and I actually did find a study that showed nurse practitioners or BSN nurses, and they basically had there were 2 different groups, and that they separated them into, and one took the general nursing management course, and the other one focused on Mintzberg's theory. And the ones that focused on Mintzberg's theory, they actually scored higher in the competency of their work. And then the last one, I think, is the educational theory. So this is the social learning theory, and this is when people learn by watching somebody else. So right now, this is where we would focus on how the person observing perceives the other person. So you've got nurse practitioners that are going to have preceptors, or they're going to basically practice under physicians, so they're going to watch other physicians, they're going to watch management, veteran nurses, veteran nurse practitioners, and how are we perceiving that when we're watching them? And they broke this up into 4 different phases. It's attentional, retention, reproduction, and motivation. And basically, how we perceive what's happening, is there a positive outcome with that, or is there a negative outcome with that? And then what are we going to do? Are we going to copy what we saw, or are we going to change it because of what we saw? So, like I said, there's preceptors, nurse mentors, physicians, management, veteran nurses that we're going to be watching. And then we want to know, how are we going to perceive what we are observing? And so what kind of results take place? So an example that I thought of was how much time we have with patients. So we could be in a clinical setting where we are observing a physician and they only have 10 minutes with the patient. And basically, they get an incentive if they see this many patients a day. And are able to meet those time needs. Well, as a new nurse practitioner, we may want to have 20 minutes with the patient. So basically, we need to know, are we going to try and speed up the process, even though that might not be the smartest idea, but we get an incentive out of it? Or are we going to take our time with the patient and maybe not get that positive outcome of the incentive, but we're taking better care of our patients because we're not as skilled as the physician who's been there for 20 years. So you kind of do with it what you will. How are we observing this? Do we want to have a positive outcome or a negative outcome? And, it's different for every situation. And then here, last but not least, we'll go over the conceptual model, how it kind of just brings everything together. So here I just had all 4 theories, and how I applied them as a primary care advanced practice nurse. So I have the family systems theory. We're going to treat the patient as a whole. We're going to look at all parts of the patient, and that includes the environment and the family. So for example, are we sending somebody home on oxygen and their husband smokes? So that's something that we want to look at. Is it actually a danger? Do we need to focus on cessation of tobacco use for the husband as well? The next one was the educational theory. It was a social learning theory. So we're learning from our mentors what NPs need to do as an individual based off of what they see. The next one is the nursing theory. So the theory of human caring science, which was my favorite, focus on caring for the patient as well as treatment. So not just the medical part of it, but the caring part of it, and then giving patients the motivation to fight. And then last but not least, the leadership theory. And so this is the management theory of Henry Mintzberg, and basically how well we work with others that we are working with if we're in a management position, and then managing the patient's care needs as well. Next, I have questions. So how could you apply these 4 theories into your advanced practice settings if it's not ones that you had used in your presentation in your paper? Next, do you use these theories in practice already as a registered nurse? I know a lot of us use Gene Watson's theory. Some of us are already in management roles. Many of us have used the educational theory and not even realized it, especially when we had nurse mentors and preceptors. And then I think that was it. And then also any questions from you guys and my references. Thank you.